The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
Thanks to Aerobiotics for sponsoring this episode. Aerobiotics produces Illuvia, an air decontamination unit that's an FDA Class II medical device to reduce the risk of infections in operating rooms. The unit is mobile, low maintenance, and with no infrastructure changes needed. It's been around since 2017 and has published studies confirming its efficacy are in the Journal of Arthroplasty, the AORN Perioperative Nurse Journal, and the American Journal of Infection Control. It's been independently tested for the elimination of SARS-CoV-2 and other viruses, bacteria, and spores.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Welcome back, everybody. It's another episode of APIC's The 5-Second Rule. I'm Silvia Quevedo, Director of Practice Guidance, and today's episode is There's Something in the Air. Yep. This episode, we're going to geek out and talk about airborne transmission of disease. We're going to talk about droplets, what floats around the air, and what can make us sick. No better time than now. We're living in this global pandemic of COVID-19. Caused by the SARS-CoV-2 virus. But actually, there are a lot of diseases that get transmitted via the air. So we are going to sort of break things down as much as we can, given the science that we have available to us. And to sort of help us out with this, we have Dr. Hilary Babcock, who happens to be the professor of medicine in the Infectious Diseases Division at Washington University School of Medicine, which is in St. Louis. She's also the medical director of the Infection Prevention and Epidemiology Consortium and Occupational Infection Prevention for Barnes-Jewish HealthCare. That's a mouthful. She is also the fellow of the Infectious Disease Society of America, IDSA, and the Society for Healthcare Epidemiology of America. We call them SHEA. She's the immediate past president of SHEA, and she's been a member of the Health Infection Control Practices Advisory Council of the CDC, and an all-around cool person. Welcome, Dr. Hilary Babcock.
Thank you. Happy to be here.
With Dr. Babcock is Kate Gase, who is the Director of Patient Safety, Quality, and Care Coordination at Barnes-Jewish, St. Peter's, and Progress West Hospitals, also in St. Louis. Her previous work experience with the BJC HealthCare includes also the New York State Department of Health and Memorial Sloan Kettering. She's a certified infection prevention and epidemiology fellow of APIC, and she happens to be on the APIC board of directors. Hey, Kate, welcome.
Hi, Sylvia. Dr. Babcock sounds a lot more impressive than I do on paper.
Well, you both sound far more impressive than me. Thank you both for being on this episode of the 5-Second Rule. And I just want to say, you two are good friends, right?
That's true.
So you're both here to educate infection preventionists who know a lot of this stuff, but also the public, because that's a big part of our audience, about airborne disease and airborne transmission and droplets and you're going to help make sense of this all. That is your charge today. Because it is confusing. And given the global pandemic, there's been a lot of talk, a lot of chatter, and actually, I think, frankly, a great time to sort of educate people on all of the different issues surrounding how diseases get transmitted. But before I do that, I want you guys probably know this because you're super smart and you have lots of letters after your name, and that's always an indicator. But according to the World Health Organization, okay, so I'm quoting, respiratory infections can be transmitted through droplets of different sizes, okay? And it says when the droplet particles are less than 5 to 10 microns in diameter, they are referred to as respiratory droplets. And when they're greater than 5 microns in diameter, they're referred to as droplet nuclei.
So, Sylvia,
okay.
I'm going to stop you right there for a second.
Stop me, Kate. Correct me.
Flipped those. And so the respiratory droplets are the bigger ones. They're greater than 5 to 10. And then the droplets are the smaller ones. So you flipped those.
The droplet nuclei are smaller than the droplet particles.
Thank you. See, you guys are so smart. Okay. So I don't even know how big a micron is, but I'm guessing that's pretty small, right?
Yes.
Okay. So in this discussion around how diseases get transmitted through the air, at some point we're going to have to talk about how big they are. Do they change size? So again, this is going to be like among our geekier episodes, which I'm really excited about. But I'm going to start with you, Dr. Babcock. Can you share with our listeners, just give them some idea of what are respiratory illnesses that we're talking about?
Sure. So there are lots of respiratory illnesses, as we all know. So right now, of course, we're all thinking about COVID, but influenza is a respiratory illness that's also caused by a virus. There are others. So tuberculosis is a respiratory illness caused by a mycobacteria. There are pneumonias that are caused by bacteria. And there are other illnesses that are transmitted through a respiratory route, but that we maybe don't think of as a respiratory illness. And so measles is an example of that, also caused by a virus, usually causes a rash and a fever, but is spread through a respiratory route. And chickenpox, similarly, also spread through a respiratory route that causes fever and a rash. So there are different ways that we can talk about, like what is a respiratory illness and what is spread through a respiratory transmission route.
Okay, so that's interesting. And oh, by the way, we're always shamelessly plugging on the 5-second rule. We did a great episode on the difference between bacteria, viruses, and fungi. So if you want to go back to remind yourself of what those are, then definitely check that out. So there are diseases that, as you indicated, are respiratory, and then there are diseases that aren't maybe respiratory illnesses, but if I'm understanding what you just said, you get them through the air. Is that right?
Yes. So they do still obviously involve the respiratory tract, but they're not something that primarily causes a cough illness or a pneumonia, though they can as a complication, but they also involve skin and cause a rash and fever and some other things.
Okay. So I've heard, for example, I know we're all living through this pandemic and everybody's concerned, obviously, about COVID-19, but is it correct to say that among the diseases you just mentioned, for example, measles is highly, highly contagious?
Yes.
Maybe, okay, more so than COVID and some of these others, correct?
Yes, measles is really one of our most contagious illnesses. It is wonderful that we have a very effective measles vaccine to protect us all against measles. In unvaccinated populations, one person with measles can infect 18 other people with measles. It's really a very easily transmitted illness.
And why is it easily transmitted? Because I think that's important for people. Like, what is it about the measles virus that makes it easily transmittable or transmissible? I always get that wrong.
So that's a great question. So what we know about measles now is that the way measles is transmitted is that the measles virus can survive in these very, very small droplets that can travel long distances, and that a very small infectious dose, a very small number of viral particles are required to cause infection. And so for all these reasons, measles is pretty easily spread. And I think this is an important point for people to recognize that there is not one single thing when we talk about how infectious or how contagious or how easily spread a specific pathogen is. It's not just one factor that drives that. It's a lot of different factors. So it's how well it survives, whether it lives in bigger droplets or smaller droplets, whether it travels long distances through air, how many particles are needed to cause infection, where does it need to get to in the uninfected person in order to cause infection. So there are just a lot of factors that go into it. It's not a simple, just this one thing tells us how infectious it is.
Okay, so, and you raise an important point, which is as we think about the current pandemic, but even things like the common cold, right? Because the common cold you can get, that can come through the air, correct?
Yes. So common cold is usually thought to be most commonly caused by rhinovirus, which is another respiratory virus, usually spread through the air, but usually spread through larger droplets through closer contact.
Okay. So, yeah, so there's a lot to think about. If you're obviously a healthcare worker, much of this you do know, I hope you know. We're going to talk a little bit more about healthcare workers and what they do and don't know about this. But I mean, if you're just the average Joe and you're listening, and we know you are, it is important to understand that there are a lot of factors that determine whether or not you're going to get one of these illnesses when you're out and about or in your home, correct? Like if you had to have a race, if this were like the Kentucky Derby and we lined up TB, measles, diphtheria, influenza, chickenpox, I know that sounds kooky, but like who would win? It sounds like measles would win, right? In that race.
If the race is won by the person, not a person, by the infection that infects the most people in an unvaccinated population, I think that measles would probably win.
Okay. I know that's, but I mean, to help people understand, you can always bet on measles. That should be the name of the next horse of the Kentucky Derby. Okay. Kate Gase, infection preventionist. I'm going to ask you about, let's talk about what people need to understand, especially healthcare workers, because I'm just going to say it. People are freaking out now. They're afraid they're going to get COVID when maybe their chances are less than getting, measles or some of these influenza. There's every year we have flu season. Talk to us a little bit about, what you do to help educate healthcare workers about, airborne versus droplets that, Hilary's talking about.
Well, so I think the first thing to really acknowledge is that because COVID-19 is so new, it's a novel virus to our population, which means it's also novel to our researchers. And so we are learning new things about COVID almost every day, it seems like. And certainly at the beginning of the pandemic, we were leaning on our partners at the CDC and at the WHO to give us this information, and the researchers that were working on this furiously to make sure that they understood it the best they could, so that we on the healthcare frontline side could do the best we could to protect our healthcare workers. So I think we're still acknowledging that this is still a new virus. We're still learning lots of new things about it. I think just the precipice of this podcast is, is it droplet versus respiratory, and what size of particles are we talking about here? We're learning new things almost every week about this. So one of the things that we're doing with our healthcare workers is just ensuring that we're transparent with them. We are acknowledging things that we know, things we don't know, and then also acknowledging the things that we're doing to try to keep them safe. So you mentioned with, influenza, we have a mandatory vaccination policy here with BJC HealthCare for all of our employees. And that is one way that we take that step because we do know that the flu vaccine works. And that's one way that we protect our healthcare workers. And we also are protecting our patients in that way. we don't yet have this COVID vaccine. So we are doing everything we can to ensure that we're protecting our healthcare workers when we have patients coming in with unknown diagnoses. Right? So we're mandating that every person that comes into the hospital wear a mask. And that has been shown. There's been multiple studies already that have shown that wearing a mask really decreases the risk of transmitting this COVID virus. And so that's good news. And we keep reiterating that to our staff. The other thing that we've taken into account with COVID that we talk about with other viruses and such is the role that so the inlet of like an eye, right? And so wearing a face shield to protect you from getting the virus and infecting yourself through the eye. Because one of the things that Hilary touched on was we also don't really know how much of the virus you have to be exposed to exactly to become infected. And then we also don't understand with everybody, if you do become infected, will you start to exhibit symptoms? And so again, that information is still coming in. And so until we really fully understand that, we are going to be extra cautious with this virus. And we are going to give our healthcare workers as many tools as we can to prevent from them transmitting the virus to patients or between each other or getting it the other way around.
Yeah, great point. I mean, I think we definitely want to implore actually everybody listening to get their flu shots, because if nothing else, it's going to help your healthcare workers at least differentially diagnose or eliminate flu when you show up with some sort of respiratory illness. So to the extent that you have access and availability to vaccine preventable respiratory illnesses, go get that vaccine. But I want to go back to this notion of droplet versus airborne. Hilary, we've read all kinds of research. We see the headlines. Can you break down for our listeners to help them understand maybe the continuum and what we're talking about when we, is there, again, I'm going to do it. If TB, measles, diphtheria, influenza, chickenpox were in a boxing match, does droplet size, who's bigger, who's going to win? To help people understand, the size and how these might travel in sort of outdoor when you're walking around. Can you help us sort of understand what this looks like?
Sure. Well, happy to try anyway. The sort of classic distinction that has been used in discussion of transmission of infectious diseases for decades makes these sort of clear boxes of droplet versus airborne versus contact as the main transmission routes for infections. And in reality, the boxes, of course, are not 100% clear exactly where there is overlap between the boxes and where things may sort of smudge a little bit in between. What we know and what we continue to learn about is that when people cough and talk and sneeze, they expel droplets of a range of sizes. And when people in healthcare settings have specific procedures done that mechanically disrupt their airway and their mucosa and the sort of normal patterns of breathing and talking through getting intubated or some other procedures like that may change the size of the particles that are generated and that can make it into the air around those patients. And so that's one piece of how we think about the risk of transmission is. We know some of these infections can travel in those small particles that can travel in the air for longer distances. We know that's true for TB and for measles, for example, and for the varicella or chickenpox virus. For influenza, we know that most of the time it looks like it's transmitted through these larger droplets that don't travel as far. But sometimes it may be possible that the influenza virus may be able to survive in these smaller droplets and smaller particles. And I think that's kind of where we are with COVID, is that we're trying to get a sense of what the dominant spread mode of spread is for this new virus. And like Kate said, we're learning new things all the time. And I think that more important than the trying to figure out what box to put it in, or trying to explode all the boxes. More important is really trying to understand what the best prevention and protection mechanisms are that we have available to us, and how important those are in community settings as well as in healthcare settings. So even people who are, arguing about whether things are more airborne or more droplet, whether that's smaller droplets or larger droplets, and how far, everyone agrees that masks are really important. So masks are a super important containment mechanism for the infected person. They minimize the droplets of all sizes that make it out into the air from the person who's infected. And masks, isolation and surgical masks and even cloth masks appear to provide protection for uninfected people as well. So they capture larger droplets. They can provide some filtering of smaller droplets, and they clearly provide a level of protection for the wearer as well. So we can all agree on that. We can all agree that it's best not to stand super close to infected people, especially if you're not wearing masks. And while the difference between standing 5'11" from someone and 6'1" from someone is probably not that important, it's a helpful rule of thumb. Farther away is better. We can all agree that it's better to be farther away, but that just because you've stepped to 6'1" doesn't mean that like everyone should take their masks off and start singing and yelling and feeling safe in that moment.
Yes.
And also, ventilation is important, being somewhere where there's good air movement, where there's open space. A lot of these things we can all agree on, and these things can have benefit and be protective against diseases that are spread both through droplet and through smaller particle transmission routes. And so rather than trying to get too bogged down into which one is the most important, I think going with the things that we all agree upon is the best messaging for the community and for healthcare settings as well, to keep everyone safe.
Yeah, and it's interesting. I know I've shared with my friends too, some of these recommendations are consistent with what you all have been saying about influenza in the past. You want to protect yourself against people who have the flu, or, if you've got a kid with chicken pox, you're not going to, bring his friends over and you're all going to hang out in the playroom together, because that's going to be a problem. But I want to go back to this notion of masks. Obviously, during COVID, this is going on. But Kate, talk to us about the difference between masks versus respirators, because there is a big difference.
There is a difference. And Hilary mentioned, the idea of a surgical mask, or sort of this general mask that you see around the hospitals, and a cloth mask. And so obviously cloth mask out in the community, there's a lot of encouragement to be wearing those. In the hospitals, our care providers, we do ask them to wear the surgical hospital provided mask. But the real big difference between this mask and the respirator is that the respirator has a higher level of filtration. So Hilary talked about the different sizes of these viruses and such, and being able to filter those out. And so the respirator, what that does is it is able to filter out much smaller particles than just a regular mask. And that's why we wear those when we are working with patients that we know have tuberculosis or measles, because those viruses are, that virus and that microbacterium, they're very small. And we know, we have good evidence that those can stay in those small droplets and move around. And so we wear those masks, or those respirators. People often are referring to them as N95s. And so that's one of those that is just about how much, what size of particle the respirator can filter out. And so that's really the only advantage of having a respirator, is being sure that we're filtering all of those small little particles out. But overall, as Hilary mentioned, things like influenza and things that are a little bit bigger in size that we talked about at the beginning of the podcast, the surgical mask is working really well. Studies are continuing to reiterate that and making sure that we know that we're safe from that perspective. So when we are doing procedures, as Hilary mentioned, that might generate some aerosols or break up these particles a little bit more, we might take that extra step and use a respirator just to be sure. So again, as we're talking about maximizing how much we're protecting our healthcare workers. But overall, the regular surgical mask is something that we believe works really well for that general contact.
So, yeah, that's helpful. But, I'm just going to say it. I've seen people walking around, like I mentioned, or I don't know if I mentioned it to you or someone else on the show, that early on during the pandemic, I got into an Uber and the Uber driver had a respirator on. I was like, hey, where did you get that? And I think I mentioned it on another show, and he's like, oh, some nurse gave it to me. And I was like, well, that sounds really dodgy. But the other issue with respirators is they need to be fitted. So you could be wearing a respirator that is doing you no good because it's not fit tested. Is that, Kate? I mean, do you want to touch on that for folks?
Absolutely. That's absolutely a great point, Sylvia. I think a lot of people don't understand that. And so our healthcare workers, when they need to wear an N95 respirator, you're right, they are wearing a particular size, a particular brand that is fitted to them, fitted for their face size, and so they go through testing for this. And so we have, I think it's been shown, I think there are a couple studies out there actually not related to COVID, but previously that wearing a well-fitting surgical mask actually protects you just as much, if not more, than wearing an ill-fitting N95 respirator. So you're right. You are seeing a lot of people kind of out on the streets with respirators. Not all of them are healthcare grade N95 respirators, of which you would need a fit test. I think you're seeing a lot of them that you see maybe construction workers wear when they're working with fine dust or things of that nature. And so those maybe not necessarily needing to be fitted, but just keeping in mind that a really well-fitting surgical mask or even a really well-fitting cloth mask may actually do you more good than an ill-fitting respirator.
Great point. Oh my God. So you heard this, folks, from Dr. Babcock and Kate. Just wear your mask, keep your distance. There are tons of factors that determine how susceptible someone may be to getting one of these diseases. You heard Hilary say, we're doing the horse race, TB, measles, diphtheria, influenza, chickenpox. Measles is going to win because it's among the smallest and it can travel, but it is vaccine preventable. So that's a factor. In terms of size, I'm thinking these bubbles, right? And inside this droplet bubble are the virus or the bacteria. And so it really depends on how much of it is in the bubble. How far, what are the atmospheric conditions? Are you outside or are you closed off in a small room? So there's so much to think about. But let me just go back. I mean, we're talking about the pandemic, but there are lots of these diseases out there, and some we probably don't even know about. I'm sorry to say, folks, stay tuned. There may be more out there. But Hilary, talk to us about what's bugging you around airborne droplet transmission and, the current state of affairs with the pandemic.
Sure. So one thing I just want to clarify as we talk about horse races and boxing matches, et cetera, when we talk about the size of these different pathogens and how well they spread, we aren't really talking about the size of the pathogen itself. We're really talking about the size of the particle that it can survive in. So some particles, some pathogens can survive in smaller particles, and can have enough of the pathogen in a small particle to cause infection, and some pathogens can't. They really need that bigger particle. They can't survive if they get dried out. They can't survive under those kinds of conditions. So just want to clarify for listeners that when we talk about the size, we're really talking about survival in particles of a specific size, not as much a difference in size between the actual viruses or bacteria. The other thing that I just want to mention. So when you say what's bugging me about the whole droplet and airborne discussions around COVID, I think that really the messaging that is the most useful is that messaging that tells people what they need to do to stay safe. And the messaging that we can all agree on is that masks of some kind are very helpful, and that they are best if everyone is wearing them. So if I wear one but you don't, then I am still at risk from you, and vice versa. So we all need to be wearing those masks to keep everyone safe, and that's true in the community as well as in healthcare settings. That provides really the best benefit.
Great.
And then the other piece is that the things like the eye protection, the ventilation, the distance, and air movement, all of those things also provide important benefit. Washing your hands, wiping surfaces, all of these things provide benefit. And I don't think anyone disagrees with any of those recommendations. And I just think it's more important for us to focus on telling people how to keep themselves safe than on telling them that we can put this pathogen right now reliably into one of those two boxes. So that's what bugs me.
Okay. What about you, Kate? What's bugging you?
Well, I was going to go with the good old fashioned, we hadn't said hand hygiene during this whole podcast, but then Hilary did mention it just right there at the end. And so I think
slipped it in.
It's a rare episode where we don't get hand hygiene in. So yeah, thanks for getting in there.
At the tail end there. I think the biggest thing for me is again, we're learning so much so quickly. It doesn't always feel like that to everyone. It feels like, okay, well, it's been 6 months and why don't we have all of this figured out? But we are learning. We're continuing to learn. People are seeking out information, and I think that that's really important. So I think that my biggest message is we need to remain flexible. We're doing the best that we can on the front line. Your infection preventionists are doing a wonderful job, working tirelessly. Your hospital epidemiologists, your infectious disease physicians, your vaccine researchers. I mean, there is a lot of work that's getting done. And I know that it feels frustrating that we're still, quote, stuck inside and we can't do anything. But if we can stick to it, and as Hilary said, everybody doing what we know we can do, wearing masks, staying far apart, washing your hands, we can get through this and it will pass quicker. So that's my public service announcement.
Well, thank you for that. I still want to go back to maybe we're onto something with like a respiratory disease board game or something. Like, I think that I'm onto something, and we're going to talk offline about maybe creating a board game to help people understand this stuff. I mean, it's a lot. It's a lot to consider, but I think you both have done a great job of educating us on, what we're talking about in terms of diseases that are transmitted via the air and that may cause a respiratory illness. I want to thank Dr. Hilary Babcock and Kate Gase, friends extraordinaire, keeping people safe in the St. Louis area. We so appreciate you being a part of the 5-second rule. And as a reminder to everybody out there, be sure to check out the APIC website at www.apic.org for more information on COVID and everything else. Thanks.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff, including Silvia Quevedo and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphin.
Did you enjoy this episode? Do you want to do more to stop the spread of COVID? Join the APIC Prevent the Spread campaign by going to infectionpreventioninu.org. There, you can sign an online pledge to prevent the spread by masking, social distancing, and vaccinating when it becomes available. By signing on, you not only pledge to do your part to stop COVID-19, but also to actively dispel misinformation being shared online. Join APIC to prevent the spread at infectionpreventioninu.org.